In a primary school in the outskirts of Jakarta, these children are forming the next line of defence in Indonesia's battle against COVID. Mother Sri Wahuni says it was an easy choice to bring her 7-year-old daughter along.
It's a government program, and I think the vaccine will help my child build her immunity.
Indonesia is using Chinese-produced Sinovac to vaccinate children between the ages of 6 and 11 because currently it's the only vaccine they've approved for kids.
We're doing more studies, including Pfizer. Once the result is out, we can use Pfizer as well as an alternative to vaccinate children.
For a while, Chinese vaccines were popular across Asia, with more than 30 nations either buying jabs or receiving donated shots. But as evidence mounted they weren't as effective, many countries switched to Western-made. But there are still millions of people who have been vaccinated by Chinese vaccines in the region, and they're vulnerable to the Omicron variant.
If we just look at the levels of this neutralizing antibody, they appear to be on the lower side to begin with and required boosting even before Omicron.
Some countries, like South Korea and Japan, have reverted to more draconian measures, closing borders, reintroducing curfews to keep Omicron at bay. But even still, cases are multiplying at a worrying rate. So far, there's only been a handful of locally transmitted Omicron cases reported in Indonesia, but it's likely to be circulating in much higher numbers. Testing rates are low here. PCR tests cost about $30 Australian, expensive for most Indonesians.
I think the government should provide the testing for free, like governments overseas.
The vaccination program is free, but with only about 40% of Indonesia's 270 million people fully vaccinated, it's unlikely to be enough to keep Omicron at bay. Carrington Clark, ABC News.